I am standing here in our x-ray room for the panoramic. So just a couple notes about exposure to radiation. We use digital radiographs, which means that there's 80% less radiation than the traditional films that used to be used. So this already is lowering the risk of exposure. And then where you stand is going to also help lower that risk. So with the panoramic machine, this is probably one of the ones people get most confused about. The radiation actually comes from the back of the head forward. So you want to be behind the patient when this is taking place. And this machine spins around the patient to take the image. That being said, whenever an apron is put on the patient, it should be done like a superhero cape and across their back, because we're going to have that radiation exposure coming from the back, forward, and this shield is going to help protect them best being on the back side. If you ever get confused about the safest place to stand, look for the radiation button. So that is always going to be positioned in a place that has the least exposure. So it's kind of hard to see, but right here on this wall is the button that you push to take the x-ray. And so that lets you know that that is going to be the safest space for you to stand and observe. As a shadowing student, you don't want to get into this room. Stay on the outside. You can still see the positioning of the patient. Come a little closer when they're getting the person into position. And then when they're pushing that button, please remove yourself from the space.